It's such a strange thing. People in this country just simply don't believe anything could happen to healthcare.
Yeah.
There are two phrases just make me mental.
Why do you think that is?
Because they've always had it.
They take it for granted.
And why would, well, you know, they used to say, I would talk to people and they say, Shirley, they're not going to let it, you know, they'll never let it go. And the other hideous statement that they make is healthcare is free. When I hear people talk about the cost here, is when there's a story in the paper of some child has been brought for an operation at Sick Kids. And they'll say, and $1,500 a day for a bed. And you think, well, not for the child, for all of us. It's not free for you. Somebody has to pay for this, and you're paying for it. It is your insurance company. And so we're at a real disadvantage not knowing the cost of health care. But also the original plan for health care was that it would be in two stages. First, you'd get everyone fixed that had anything wrong with them. But secondly, then you would switch into the second stage of health care, which would be prevention, a new way of delivery of health care in many instances as health. And you have to adapt as the healthcare system changes through technology, we didn't have MRIs. We didn't have this. Doesn't mean we won't get them or shouldn't get them.
But that's, I'm glad you brought up MRIs, because that's the excuse or reason people will say, I want to go to Buffalo to get an MRI. Or
well,
a
if you don't
clinic.
have enough here, I understand why you think you should go to Buffalo.
Why shouldn't I?
But why don't we have them here?
Because it's too expensive.
Not worried about.
We can't afford
Well,
them.
that's just ridiculous. You know, I used to hear about it's so expensive. It's $1 million.
It's a lot of money.
It's not a lot of money if you can do what you can do with an MRI. If you need an MRI, buy one. That's part of the expense. The real expense is running an MRI. But you know, what are you going to do? Just tell people they can't have an MRI, that they're not going to be part of it? You know, you have, this is what I mean. You have to adapt and move and change the way you deliver health care. We no longer have everybody in the hospital for 3 or 6 months. So you're saving money there. You're putting people out of the hospital much faster due to technology. You're doing operations that before just did terrible damage to people and it took a long time for them to recover. You're now doing operations. People are having quadruple bypasses and are out in, you know. But you need MRIs. You need diagnostic tools, and you have to have them.